This is lactation induction, or also known as adoptive breastfeeding, for the breastfeeding practice and research course at Johns Hopkins School of Nursing. My name is Rachel Rands, and Jenny Lawson is also going to be explaining this process. This is for breastfeeding for those who have not given birth.
The objectives of our presentation is so that people can understand and be able to define induced lactation, describe the methods of inducing lactation, and identify the benefits of inducing lactation.
So, induced lactation is the process of preparing the body to breastfeed by stimulating a pregnant state with the use of hormones, which are typically birth control, followed by the use of galactagogues, which are things that stimulate milk production to increase and maintain a milk supply. And so you don't need a uterus nor ovaries to carry out this process, and typically it's for parents adopting. Grandmothers have been known to do this to breastfeed their grandchildren, and parents that are having children via surrogacy that want to breastfeed. And it has been known that men also have been able to induce lactation to breastfeed as well. And then, of course, postmenopausal women, which could also be a grandmother.
So the methods of induction: nipple stimulation, hormones, galactagogues, herbal supplements. The best methods are a combination of all of these methods. So before we go into how you induce lactation, we're going to do a quick review of lactation physiology. These are the important hormones in your body that produce milk. Estrogen stimulates prolactin production. It stimulates the elongation of ductal epithelial cells. Progesterone triggers milk secretion. It also induces duct formation branches from the main tubules. It's the key inhibitory hormone so that after delivery of the placenta, levels fall and milk secretion is triggered. Prolactin is the essential hormone in lactation. It's necessary for lobulo-alveolar development. It stimulates milk production and secretion from the alveolar cells, and it's produced by the anterior pituitary gland. Oxytocin triggers the milk ejection reflex. It does not directly contribute to milk production. It's also produced by the posterior pituitary. And lastly, nipple stimulation, which induces oxytocin release. It triggers prolactin release from the pituitary gland, and the oxytocin release helps with the letdown reflex. So nipple stimulation is arguably the most important factor in promoting lactation in people who have not been pregnant. It's the main non-pharmacological method. Researchers say that mammary stimulation is associated with increased levels of prolactin secretion and thus milk production. It can be done by hand or by pump, and it basically simulates or mimics the suckling of a newborn. So nipple stimulation by hand. It's recommended that this is done several times a day for 5 minutes on each breast, as much as 6 weeks prior to the baby's arrival. And it basically you take your hand and you in a circular motion stimulate your nipple. The more recommended method is with a hospital grade pump, and it's recommended that you do this with both breasts simultaneously every 3 hours for 2 months before the expected arrival of the infant. So next is our hormonal methods of inducing pregnancy, and the idea is to introduce hormones into the body that mimic pregnancy. So it's to make your body think that you should be producing milk physiologically. During natural pregnancy, estrogen and progesterone stimulate the proliferation of the alveolar and duct systems in the breast. In one study, women were given Depo-Provera, which is a form of progesterone, and estrogen daily over 6 to 9 months before putting the baby to the breast. So basically, you take a combined progesterone-estrogen birth control pill that contains at least 1 milligram of progesterone, and you give this to the woman to create pseudopregnancy within her. The important thing with the hormonal methods is that you stop at least 2 days before you put the baby onto the breast. Oxytocin is another way to help stimulate or to help with induced lactation, and it doesn't actually help you produce milk, but it helps with the letdown reflex, which is the same thing that nipple stimulation does. So one way you can do this is by an oxytocin nasal spray. This is actually very rarely used because it's not available in the U.S. currently.
So the galactago that's mostly used is domperidone, and that suppresses the dopamine, and that subsequently increases breast milk volume. It does not cross the blood-brain barrier and is not known to cause depression, unlike the other one, which I will show. It is mainly used most commonly as an antiemetic, and it increases prolactin secretion indirectly by interfering with the action of dopamine. And that's to decrease the secretion of prolactin by the anterior pituitary gland. It's also used for disorders of the GI tract, and it's been found to increase serum prolactin levels from 8 to 124 nanograms per milliliter in non-lactating women after just one 20 milligram dose. But it's recommended 10 to 20 milligrams 3 times to 4 times a day. Metoclopramide is also an antiemetic, and it has a bigger side effect of depression and crosses the blood-brain barrier, so it's not really used commonly, and it's not recommended for use in long term. It's also known to produce significant increase in prolactin levels and has been shown to be a useful galactagogue. This is also, the dose is 10 to 15 milligrams, 3 to 4 times a day, 4 weeks, then just every 2 days for a total of 2 weeks. Studies show a increase to 66 to 100% in milk production. Other supplements you can use for stimulating milk production are herbal supplements, where there actually isn't scientific evidence to support this, but has been known anecdotally to increase breast milk, as blessed thistle herb, fenugreek seed, goat's rue, which is the picture in the right-hand corner, and these leaves stimulate the development of mammary tissue and is one of the most potent herbs to increase breast milk, so it is said. And it's also used to increase breast size in non-lactating women. Other herbal supplements are fennel, garlic, and chaste tree fruit.
So the current recommended protocol is 6 months prior to arrival of the baby to start a combination progesterone, estradiol birth control pill. And then you would continue taking this until 2 months prior to the arrival of the baby. 5 months prior, you start with domperidone. You take 10 milligrams 4 times a day for a week, and then you take 20 milligrams throughout the breastfeeding. So 2 months prior, you stop the progesterone, estradiol birth control pill, and you begin nipple stimulation. You can do it by hand, but the recommendation is a hospital-grade pump, and by doing it every 3 hours and then once during the night. And this you do until you can put the baby on the breast. So immediately on arrival, put the baby to the breast, and then you supplement as needed to ensure that the baby gets enough milk. And you continue taking domperidone until you have satisfactory milk supply.
So, if in fact you do make milk production, that's a bonus, which is the whole point of this. But I think most women you'll talk to will tell you that they do induce lactation for the bonding process. Most likely you're going to need to supplement your breast milk with some other form of supplementation. And we actually spoke with a woman who got breast milk from a milk bank. So she was able to use that to supplement her breast milk, and you can do this by a supplemental nursing system, as you can see on the picture. you wear it around your neck and you put the little tube in the baby's mouth so that they're getting this as they suckle. And more women prefer the lactate system because it's a plastic bag that fits around your skin as opposed to a hard, non-forming plastic bottle. And supposedly you don't need tape for the lactate as well, which helps with, your skin.
Another reason that people use these is if they don't want to induce lactation or if they're unsuccessful at lactation, they can put formula in these systems and also kind of pseudo breastfeed for the bonding experience.
Okay, well, most women, and I guess men, do it for the bonding experience. Domperidone is the one that's typically the key player, and you cannot get this in the United States. So the woman that we spoke with that was successful in doing this actually initially ordered this galactagogue from New Zealand and then was able to get it from Canada. So that is where she got it. The FDA in the United States does not approve of this because of the possible cardiac side effects. However, this step was taken without considering the fact that the cardiac side effects occurred only when the drug was taken intravenously, and it's most likely a different dose than you would take for other reasons, and not disapproved for lactation purposes. But getting an FDA approval is a big endeavor, and using it for inducing lactation would be probably not the most worthwhile process. Most people who induce lactation are not able to produce enough milk to sustain their baby, especially at first. It's also been known that you don't produce colostrum when you induce lactation. But I think if you talk to someone that's been successful at this, they will tell you that that they would do it again, and that they wanted to feel like they were bonding with their baby, and the skin-to-skin contact. What do you think, Jenny?
Yep, I think the skin-to-skin contact, some of the physiological benefits from breastfeeding are transferred to the baby, and just the bonding and the whole process. It can make someone feel that that they are really supporting and providing for their baby.
And it's important that the person doing this have a really good support system. It's a huge commitment, and when you're taking hormones, you might not be the most emotionally stable. It could be frustrating if you're really expecting to have a big milk supply. So you just kind of need to speak with the woman ahead of time to find out what their goals are, and so that they can remain flexible and not discouraged.
So these are our references, and at the bottom there in blue, there are some websites if you have questions or need more information, and we're also available right now if you want to ask us questions. Thank you.
Just call right in.